Good afternoon. My name is Annette Zerby. I am the Vice President of Compliance here at Peach State Health Plan, and I'm going to start us off today. Um, Little public service announcement that all of these presentations can be located at www.mmis.georgia.gov. Click on the tab called Provider Information. Click on the tab Provider Notices, and you will be able to locate this presentation. Also, for reference, after this session or anytime, you feel free to reach me at annette.zerby@centene.com, and I will get your question answered as best as I can, as quickly as possible. And we're just waiting for the presentation to come up. There it is. Perfect. All right. So here at Peach State Health Plan, we currently employ over 600 local employees that are scattered throughout the state of Georgia. We have been in the program since its inception. I've been in a partnership with DCH for 17 years now. And as of today, we currently serve over 1 million Medicaid members in this program. Today, I'm going to talk about the redetermination process, the work that Peach State has done up until this point, and the work that we're going to be doing going forward. So, I'm going to start by reviewing the work that we've done up until this point. So, both our messaging to members and providers has been focused on ensuring our members have updated their contact information into GAMUS. So, that work is really important to ensure that all of our members receive the state's redetermination notices when they go out the door. Many months ago, we ensured that all of our member and provider facing staff had in depth talking points surrounding the redetermination process so that they could field any questions that were received. That is really critical as we take more than 60,000 phone calls from members and provider every single month. We knew that it was our call center staff in particular that were really going to be fielding much of the questions coming in. So we followed that up with pop-up messaging on our website so that every time a member went to that website, they received a pop-up message that one asked them to go into the gateway site, ensure that their information was accurate, and if not, to go in and update it, as well as providing a link to gateway. So all they had to do was click on it to go out and verify that information. So we also then focused a lot on more widespread communication through all of our remaining channels. We did a very large text messaging campaign, social media notices, member newsletter articles, flyers at all of our member and community events. When we talk about the work that we've done with our provider community, we again deployed some of the same communication strategies that we used for our members through newsletter articles and talking points. Those newsletter articles focused on how you can remind the members to keep their Medicaid information up to date, an explanation of the upcoming redetermination process, and detailed instructions on how members can update that contact information. We also expanded that approach by utilizing email notices to each of your offices. So if you did not get those notices, please reach out to your PR rep to ensure that you have good contact information out there in our systems. So let's talk a little bit about going forward. What's the work going to look like, and what are we doing? So this past fall, we started collecting updated member addresses, cell phone numbers, and email addresses every single time a member called into our call center. You remember earlier I mentioned that we get 60,000 calls every single month. Well, half of those are from members. So it was a tremendous opportunity for us to collect that information for anyone that had not taken the time to go out and update it in Gateway. We have been collecting it separately. We've been sending that information to the states so that they can use that secondary address for outreach to members when it's their month for redetermination. We've also been visiting high volume provider offices, utilizing campaigns such as email campaigns. We'll be doing those, kicking off social media. awareness campaigns. You'll start seeing more coming out in newsletters and flyer handouts. I'm going to turn this over now to Dwayne Flowers to talk about provider contracting.
Good morning. Hopefully everyone can hear me. This is Dwayne Flowers. I'm the VP of Contracting for Peach State Health Plan. I've been with the organization since 2006 prior to go live. And since 2005, Peach State has been building and maintaining a extensive network just to make sure our members have coverage for whatever services are needed. We actually remain committed to sustain an enhanced network of providers through a spectrum of medical services, including dental and vision, and also behavioral health. New individual practitioner and organizational providers are added to the network when we assess our network on a monthly basis. If you're interested in participating in Peach Day, please feel free to go to our public website, click on providers resources, and then you can join. It's imperative that you're credentialed by the state of Georgia prior to becoming a Peach State member, and so be familiar with the CVO process. If you're affiliated with a group that has delegated credentialing, please follow your in-house rules. We also monitor our network adequacy and establish standards by DCH. We look at distance, specialty, and provider quality as well. Next slide, please. This analysis takes in consideration our patient population. We look at racial needs, ethnicity, cultural needs as well. We also look at it from an urban and also a county level. We also look at out of network utilization. If we're actually constructing single case agreement for a provider that is not participating in our network, and we try to recruit that provider so we eliminate any gaps. Next slide, please. And we also try to identify deficiency. So we partner with our current participating providers, large groups like Piedmont, Emory, Grady, Wellstar, and CHOA. We also offer telehealth services in rural markets. Next slide, please. And we also do a comparison of the state 7400 file just to make sure everyone is familiar. The 7400 file that are received by the CMOs actually lists all Medicaid eligible practitioners throughout the state of Georgia. And what we do a monthly comparison of that file. And if there's any providers that are not currently participating in our provider, we do attempt to recruit them into our network. We also make ongoing and continuous outreach to primary care physician. We try to identify shortages in our rural markets as well as our urban areas as well. We are in the process of enhancing our telehealth network for all products, including Medicaid. And if you're interested in becoming a telehealth provider, please let us know. Next slide, please. Okay. I'm going to turn it over to Brittany Mathis, our VP of Provider Relations.
So good afternoon, everyone. My name is Brittany Mathis. I'm the Vice President of Provider Network Performance, and I've been with the health plan now for a little over 15 years. Today, I'm going to discuss some of our provider relations engagement strategy for 2023. So we are this year in the process of returning to in-person engagement. So we are scheduling in-person visits with our providers to discuss, quality programs that we have, provide education. We are also continuing with our senior leadership roadshows. We have done roadshows in the past all over the state where we take some of our senior leadership team out to the providers all over Georgia, rural and urban, just so they can experience provider relations, and providers can have a chance to speak with some of the senior leaders at the health plan in case they've got ideas, recommendations that they can take back to put into place. We are also participating in several provider association stakeholder events. this year. I'm excited that I think all of them this year are going to be back in person. So that's really exciting because I believe in-person engagement is more engaging than some of the virtual meetings that we've been having. So really excited. Monthly provider newsletters. So we have been producing a quarterly newsletter up until this year, and now we've started back monthly again. The newsletters are going to have a new look and feel to them. They're going to have more notable topics for providers to relate to, and a more robust format that is more eye-catching, that has smaller areas of information that is appealing to the eye and will make you interested to read it. We're also offering monthly provider trainings. We call those information hour webinars, and it could cover a various array of topics. So some of you may have already attended one of our webinars this year. If for some reason you missed it, we do publish these webinars, these information hour webinars, on our unsecure portion of our Peach State Health Plan website under provider resources. Okay. And also today, I'm going to talk with you about telehealth services. So Peach State Health Plan, we have a telehealth program, and we do this in association with the Global Partnership for Telehealth. So Peach State Health Plan, we fund and purchase the installation of equipment for participating providers to expand and improve the member access to provider services, more likely in the underserved parts of Georgia. The program's goal is to enable all rural Georgians access to specialty care within 30 miles of their homes. Some of the partnerships we currently have in place are listed on the screen: Albany Area Primary Clinic, Kids Care Clinic, Mercer Medicine in Clay County, South Georgia Primary Care, and Eastman Pediatrics. If any of you are aware of where these practices are, they are in rural Georgia. So here is a more inclusive list that has some additional providers on the slide. So we provide grants for the traditional telehealth equipment, the laptop with the scope, and then we also provide retina view machines as another form of telemedicine. The retina view machines are for the diabetic retinopathy exams, and those partnerships are with Care Connect, Gwinnett Clinic, and Curtis V. Cooper in Savannah, Georgia. So as you all know, since 2020 and the COVID pandemic hit, telehealth has skyrocketed. On the screen, you can see the utilization of telehealth services by paid claims with Peach State. The orange shade is for behavioral health services, and the gray shade is for physical health services. As you can tell, we are seeing a drastic increase year after year for telehealth services. And Peach State Health Plan, we support telehealth. We are definitely a supporter of it, and we follow the state Medicaid guidelines when it comes to telehealth billing. And now I'm going to turn over the presentation to Remy Rodriguez, our Vice President of Behavioral Health Programs.
Good afternoon. I'm Remy Rodriguez, the Vice President of Behavioral Health for Peach State Health Plan. And in case any of you would like to contact me, my email address is remedios.rodriguez.dominguez@centene.com. I realize that is a mouthful, so I will spell it out for you. REMEDIOS.RODRIGUEZ@centene.com. Thank you for attending our session today. I'd like to talk with you a little bit about the comprehensive behavioral health network that Peach State has. The focus of our network is to ensure all of our members have comprehensive access to different levels of services that they need to remain healthy and well in the community. Our first service offerings are for those members that require more comprehensive care, such as severe emotional disturbance or substance abuse issues. And we have in the network all of these CSB providers and the core providers. These providers have a wide range of ability to deliver services that include in-home care, rehabilitation services, telepsychiatry, teletherapy, and psychological services. In addition, we have our tier 3 providers that are more focused and specific needs of our members. These providers include peer support to help members navigate the behavioral health system, as well as focus on their preventative care. We also have assertive community providers, intensive family providers, and medication assisted therapy. Um, the ACT providers and IFI providers, as they're known by their acronym, focus more on those members with chronic behavioral health conditions that need more focused care, both in the community, at home, and in office. Whereas our medication assisted providers focus on opioid addiction and other addictions that can be treated by daily maintenance, as well as rehabilitation services. In addition, we have a comprehensive network of autism spectrum disorder providers that offer evaluations, applied behavior analysis, and family treatment throughout the state. We try to focus on our rural communities as we realize that many of our members with behavioral health conditions may have more difficulty in getting into urban areas. Additionally, we provide a comprehensive wide array of outpatient services to include psychological testing, therapy, group therapy, um, as well as a focus on contracting with providers in the schools through the state's APEX program and our comprehensive network of school-based clinics that offer not only behavioral health services but also integrated care, so our members can receive the services they need under one location. We know that telehealth has become an important addition to our access for members and our members' ability to access the needed behavioral health care. So we do have enhanced telehealth services, not only through all of our community providers, but also through Brave Health, a dedicated behavioral health network that can offer both medication management and therapy services. For those members that need a higher level of care, we do contract with all of the state's psychiatric residential treatment facilities. And we also contract with a facility that specializes on eating disorders, as well as all the freestanding psychiatric hospitals and psychiatric units within med-surg facilities. And those facilities also offer partial hospitalization and intensive outpatient programs that focus as a step down from acute care and can offer services from 4 to 8 hours in both virtually and in the community. Next, please. We understand that both of our providers and our members need additional assistance, not only navigating the behavioral health system or the healthcare system in general, but also in providing education and assistance to social determinants of health or access to social determinants of health. In order to be able to meet this need, Peach State offers integrated targeted case management and looks at our entire member population based on specific needs. Those with complex case management needs and lower from there. Um, our, our integrated case management teams look at care in a holistic manner and also utilize system of care uh, concepts where we try to look at the whole person, both medical and behavioral, as well as connect our members with community resources to ensure that they thrive in the community. For behavioral health, we have some innovative programs that target specific member needs. To be, and we have a program that focuses on suicide prevention called Choose Tomorrow. The aim of this program is to look at all of our member population and identify those members that may be at risk for suicide ideation or depression. And then we provide additional support to these members by reaching out, connecting them with a community provider, as well as providing educational resources and communities resources. In addition, we have a focus program called HALO, Health Assistance and Outreach, for our members that may be experiencing substance abuse disorders. Through this program, we identify all of our members that are at risk for substance abuse, do a comprehensive assessment, and then work with them to receive services from our community providers. Another innovative program that we have had for the last 5 years is Member Empowerment to Succeed. This program focuses on members that have been receiving behavioral health services um, and are needing extra assistance to transition back either from an inpatient level of care to the community or from a community provider to other um, uh, community services such as um, support groups through NAMI or other organizations. Finally, we do have other innovative programs that we've initiated in the last year and a half, including Hillside in-home services. This is a program that focuses on members transitioning from a PRTF level of care and ensuring that the member receives intensive care in the home and is able to engage with community providers and community services, thus avoiding inpatient admissions and ER visits. Additionally, we have a value-based a care program for our behavioral health providers that focuses on CSBs, core providers, and large community providers. Our value-based program is designed to give providers the tools to engage members that are at need for behavioral health services but have not received services. And it also incentivizes our providers to continue engaging members throughout their whole entire course of treatment and obtain positive outcomes through pre and post standardized evaluations. Next slide, please. Peach State Health Plan understands the importance of our partnership with our providers, and we have a dedicated behavioral health provider relations team. This team is available to offer both HEDIS education, assistance with any issues that our providers may experience, as well as education on our incentive programs. In addition, Beach State Health Plan has a comprehensive training program for all of our behavioral health providers. Our training program is composed of both monthly webinars on specialized behavioral health topics such as integrated care, substance abuse, depression, autism services, anxiety, and the list goes on. We also offer our providers 24 hours a day, 7 days a week, a free training program that has CEUs attached to them. We understand that the time our providers spend with our members is very valuable and that they may need to get their additional education at times in the evenings or on the weekends. So this 24-hour day, 7-day a week program it helps our providers obtain the CEUs they may need, as well as develop any skills they feel are important. All these services can be accessed through the Peach Day website. The link will be provided to you, or is provided to you in this presentation that will be posted on the GAMA's website. Next. Finally, I'd like to leave you with some member and provider resources that you can access at your leisure. I've already spoken a little bit about the evidence-based webinars. Just the resources. Okay. I apologize for that. It looks like I lost connectivity for a minute. I was saying that I'd like to leave you with some member and provider resources that you can access in our website and at the links offered in this presentation. That includes different trainings that I've talked about. It also includes a suicide prevention website where you can go and obtain resources around suicide prevention, our prior authorization lookup tool. And for our members, we do have a 24-hour, 7-day-a-week nurse advice line, and the phone number is listed on the presentation, as well as a mental health crisis line or behavioral health crisis line where members can call and get and be connected with a clinician day and night. We also offer for our members a program called My Strength. Through this program, members can go online, get education about behavioral health, as well as do online counseling with several modules such as sleep apnea, depression, anxiety, chronic pain, and more. We thank you. And Larry Santiago from the Peach State team will be talking with you about provider incentive programs.
Thank you, Remy. This is Larry Santiago. I'm the Senior Director of Quality at Peach State Health Plan. And my email address is lsantiago@centene.com. Again, lsantiago@centene.com. So today I'm going to talk about how we engage providers and members to meet our goals. And I'm going to start off with talking about the P4P program that we currently offer at Peach State. And the P4P program is a program that focuses on preventive and chronic care management for our members. Any provider with an assigned member qualifies to participate in the program. The program is based on member assignment. In addition to that, we have a set of targets that we use in the program. We have 25 targets. Those targets reflect our population. So about half of them are pediatric measures that we target, and then the rest are screening and chronic condition management measures. Each measure is rated independently. So providers have the ability to earn dollars in one measure or in all measures, depending on how they achieve in terms of the targets. The other thing to note, we determine the measures based on the state targets and NCQA focus. Next slide, please. So other provisions of the P4P program. There are 3 cycles for reporting with interim payouts for the program. And that's not to say we only report 3 times. We actually have several reports that we offer providers. One is in through the portal. One is in our provider analytics tool. So on a monthly basis, providers are able to go in and look at their scorecard to see how they are performing. In the provider analytics
Okay, can you guys hear me? Larry is having connectivity issues. And so the measure periods from calendar year January 1st through December 31st, unless the measure use a different cycle. Actually, no contract amendment is needed. And a lot of our providers always ask this question, is there an element of risk? And the answer is no, it's upside only. Three-tier targets based on low, medium, and high threshold, and each thresholds pay an increased percentage of the incentive dollars. Opportunity to earn additional incentive if the practice is PCMH. Next slide. Okay, the 2023 incentive program is designed to support your outreach to members for annual visits and condition management. It helps us to better identify members who are eligible for case management, which is always something that we're trying to do. Increase visibility into member existing medical condition for better quality of care for chronic condition management. Earn bonus payment for thoroughly addressing patient current condition. And providers are eligible for a bonus for each completed appointment agenda, and this is something that we're trying to disseminate to our entire agenda. There's other revenue streams that can earn you additional dollars with Peach State Health Plan. Next slide, please. Okay. There are two ways to submit your documentation for the COC bonus. Log on to the COC dashboard, assess as many members as possible, correctly code confirm conditions on claims, specify the condition that do not exist using the checkbox function on the dashboard, and assess disease condition annually. Or print the appointment agenda from the COC dashboard, sign, date, and submit the completed appointment agenda. Or you can fax it to 813-464-8879 or via our secure email to agenda@centene.com. Submit a claim/encounter containing all relevant diagnosis code. Next slide. Other provider program. Fall push program. Targeted program offered in the latter half of the year, which is focused on key measure with payment per transaction. OB pilot. Pilot program offering additional payment for timely prenatal and postnatal visit. Notification of pregnancy program. Additional payment offer for timely notification of pregnancy. And we also have our value-based program. Sometimes it does include an element of risk. Next slide.
Hello, this is Larry again. Can you hear me? All right. So for some reason my laptop is not working. So all right. So the last area, thank you, Dwayne, for covering while I was trying to reconnect. The last area we were going to cover are the member engagement activities, and there are really three key areas that we look at in terms of member engagement. So there is direct member outreach, primarily done through telephonic outreach, and we have teams of people that they make calls from the Peach State office, but we also have people who actually go into provider offices and make calls to members from provider offices. And the reason why that's important is the member sees the provider's name and number come up on their screen when the call comes in, as opposed to another number that may be a Peach State number or a number that they don't recognize. So we offer that service. In addition to that, we have texting, emails, and letters, and these are different campaigns that we offer throughout the year. that target members for well visits, for immunizations. We provide member education on different measures and chronic conditions, so that it's little reminders that gets them to hopefully get them to call their provider and go in for a visit. Um, the other area we engage members in is with in-person events. We have Peach State Days where we have clinic partnerships with our providers to get members in for well visits, as well as mobile van units that we partner with providers to do screenings. We also have baby showers, and then we collaborate with local partners, whether that be school-based clinics or PTOs or daycares, to target and engage members that way. And for all of these items, we offer members incentives. So on top of uh, uh, outreaching to the member, getting them engaged, and the providers incentive programs, we offer the member incentive programs so that we get them motivated to go in and see their provider. So I believe that is the last slide. So with that, we will turn it over for question and answers.
Okay, thank you, everyone. Does anyone in the audience have any questions? If so, you can raise your hand. And it'll automate you. We'll unmute you, sorry. We'll unmute you to ask your question. Great. Hello, Ralph O'Connor. What is your question?
Yes, I asked this same question I asked the AmeriGroup folks. We're a very small primary care clinic, and we have, I believe there are at least 13 of our patients think they have Peach State Medicaid, but when we check their eligibility in GAMUS, they seem to have been dropped in the last year. Do you have any suggestion? It seems to me there's a glitch because this is across all the CMOs, but it's mostly AmeriGroup and Peach State. Maybe because there are more patients that way. I don't know. We have no fee-for-service patients that have had their Medicaid eligibility dropped, and I've put a question in through GAMUS and haven't got a response yet from them or from Gainwell to find out. Is there a way that you all can go in and check your patients and see who's been dropped from your roles and why? Because these folks say they think they still have Peach State.
Okay, thank you for your question. So have you checked the eligibility on the GAMA site to ensure that the member is still eligible?
That's how we discovered it.
That's how you discovered it. Okay.
Right. It says, they had Peach State up until X date, which was generally in the last year, which we thought wasn't supposed to happen unless they got private insurance.
Yes, sir.
And they're saying they don't.
Okay. Could the members have aged out? Well, I guess you said they're still on GAMUS. What is your phone number? And we will have your provider representative call your office and you can provide the list of members and we can check into those for you.
Okay, my number is 404-242-1234.
And what is the name of your practice?
Community Advanced Practice Nurses. We've got credentialed providers, but we do not have a contract with you all. But we're concerned that, so we're not going to get any money out of this, that with the redetermination following the public health emergency, if these folks aren't on anybody's list, and they tend to be very low income, a lot of them are homeless, they're going to fall off the radar. And we just
Yes,
want
sir.
to make sure that doesn't happen.
Yes, sir. Okay, well, thank you for your question, and I will send this over to your provider network specialist to reach out and work with you to determine what's happened to these members and their eligibility
Okay,
with
great.
Peach
I
State.
appreciate it. Thank you.
Thank you. Okay, okay, I see a question from Ms. Shay Minnick.
Hello. I submitted this issue in registration. So do you have record of those questions already?
Yes, ma'am, we do, and we are going to make direct provider outreach for some of those, or we can answer some today
Okay.
during the meeting.
The-
We were
the
trying to take the
question-
live ones first.
Okay, the question is in regards to the MPPR policy, payment policy that is being applied to Children's Intervention Service. There is a paragraph in your policy that excludes Medicaid coverage, and it states that if there's a conflict between the Medicaid manual and the Peach State manual, then Medicaid supersedes. And your VP of Compliance quote said, "The language cited is meant to convey that if both Peach State and DCH have a payment policy with conflicting language, the DCH language will prevail. In this case, the DCH has no payment policy, and as a result, there is no conflict." The problem is the Children's Intervention Service Manual payment policy is the specific fee schedule that is specific to Children's Intervention Services. And my contract with you says I get 100% of that fee schedule. And so I would like a comment, please.
Hi, can you hear me?
Yes.
Hi, this is Annette Zerby. Hi, I am the
Yes, you were the
compliance
one
officer
that
that responded.
responded. Yes,
That's
ma'am.
correct.
Mhm.
That's correct. It is a common practice for a bundling type of policy that when you are providing similar services on the same day, that there is a reduction of service or reduction of reimbursement. It's usually a very small reduction, and it's to account for the administrative services that are usually provided during each visit. But because the member is coming there for multiple visits, that administrative fee is only reimbursed one time. There is no policy in conflict with the DCH policies. Unless you seem to have one that you could send to me, and we'll be more than happy to take another look at that.
Have you looked at the Children's Intervention Service Manual? It has its own fee schedule.
Correct. Fee schedule recognizes the base reimbursement for each service. So if that reimbursement, or excuse me, a visit was provided on one day and then another service on another day, those would be the
No, we're being
reimbursement amounts.
reduced for the same physical therapy that is using 110 and 112 codes during the same visit. This isn't the difference between OT and PT on the same data service. And we're supposed to use modifier 59 to prove that those were two distinct services provided for the child. So the family doesn't have to come to my clinic 3 days a week.
And I understand what you're saying, yes. So let's have a secondary conversation about it, and we'll pull your claims reports in the meantime, and we'll meet.
That would be lovely.
Okay, thank you, Annette and Shay. Any other questions in the audience? Please raise your hand. Okay, Justin Brown.
Hey there, I'm in behavioral health. I had a question about service dates for prior authorizations. If there's already an existing authorization in place and someone on our team goes to submit a new request, we're not allowed in GAMIS to interfere, to have any overlap at all in those service dates. And it causes a lot of automatic voids that never go through in the system. And GAMIS hadn't been able to answer it. And the behavioral health team that I've talked to before says it's just kind of how it is. And we'll ask about it. We'll let you know if we find anything out. But that's never come about, and it's not a thing that exists with other CMOs, and I don't think it used to exist with Peach State. So I was just wondering if there's any knowledge or guesses on an explanation about why that has to be that way or why it is the way it is.
Thank you for your question. We appreciate you bringing it to us. Uh, what I'd like to do with that is I would take your name and number. We do follow gammas, so if it's overlapping via gammas, we are not able to make that change. But it sounds like there may be something additional here that we need to review and look at. So if this is okay with you, I will reach out or have one of our provider network specialists reach out. I will get specific details, examples, and I will research again if that's something we can remediate and avoid from happening in the future.
Okay, yeah, I've seen examples before, and it's just curious because if it's CareSource or AmeriGroup and you submit a new request, either nothing happens to the existing requests, the service dates don't change, or they're automatically truncated to the date before the new request start date. So it just puts our request for Peach State at a disadvantage. And I do think, as far as I can tell, it's something that just changed in the system for no particular notice or reason in Gammas a while ago. But yeah, I can provide my info, or I have your email as well to follow up on this. But
Thank you. Justin Brown, the stacker, Mr. Brown.
Yes, that's right.
Thank you so much. If you would, yeah, you have my email. That would be the quickest way, and we'll definitely do some research and fix it as appropriate.
Okay, thank you very much.
Thank you.
Okay, next up, Miss Patty. I don't want to rivet Tuso. I don't want to say your name wrong.
Did I get that unmuted yet?
Yes, you are.
Okay, good. I have a question about effective dates. And this is something that only Peach State sets the effective date of an authorization to the date they make the decision. Whereas AmeriGroup, CareSource, and all other insurance companies, Blue Cross, United Healthcare, Cigna, every company will set the effective date as of the date of submission of the request. But Peach State requires or will only set the effective date as of the date the decision is made. And everybody has, in the CMOs, has 3 days to make a decision. So for Peach State, we have to always have a lead time of 3 days before we can see a child again if we're going to be covered by that. And if we do an evaluate, we see our children every week, once every week. So if we do an evaluation on a Monday, the therapist needs time to get that evaluation report prepared. They may not have it ready to be able to submit to Peach State by Wednesday in order to be able to cover for the following Monday. It may be Thursday, but at that point, we've missed the 3-day lead time, and the authorization effective date won't be set. If they make the decision on Tuesday, we will miss out on being covered for that Monday. And we don't want to keep changing scheduled appointments when children come the same day of the week, same hour, just because of this 3-day lead time required, which is really a hardship to try to get everything in place ready for that. And so we were just wondering if Peach State would ever consider changing their process to allow an effective date to be established just the same way as AmeriGroup, CareSource, Cigna, United Healthcare, all insurance companies set an effective date as of the date of submission of the request rather than the date of the decision.
Right. Yes, ma'am. We do have some representation from our medical management team on the line with us this afternoon.
Hi, good afternoon. This is LaQuanda Brooks. I can answer that question, and I would probably like to follow up with you as well. So we adhere to industry standards for prior authorization requests. And the reason we do that is so that we can ensure that your review of your medical necessity review has been completed and approved prior to you rendering any services. I think I would like to better understand how we can better be a better partner and assist you with providing that notification in a timely manner so that we do have the 3 business days for our standard and a 24 hours for our expedited to ensure that you are not rendering those services prior to receiving that approval. So there may be some opportunities for us to discuss. So if you could please give me your contact information and I can have someone reach out to you directly so that we can work to identify how we can best partner together with getting you those approvals in a timely manner.
I just wanted to mention, you do get them timely. We always get them within 3 days, but the problem is that the effective date is established as of the date, that third day when we get that approval. But all other companies, AmeriGroup, CareSource, Cigna, United, all of them will give that effective date as of the date of submission. And like when we know that the child does not need the therapy anymore, we're not going to continue to provide services. So we pretty much know that this is going to be approved. And so in not providing the service, it's not really a questionable thing. It's not a first time in, gee, I wonder if this person needs a service. They need it, each 6 months we have to go through this process, and their scores do not fall within normal limits. Everything all leads to where it's going to be approved. But because of this 3-day lead time requirement, it puts out Peach State truly is the only company that we work with outside of Medicaid programs, everybody that won't set the effective date as of the date the request has been submitted. All other companies do it as of the date of submission. But
thank you. Thank you for that additional feedback. I can definitely get your information and follow up with you. But again, the reason that we ask that you allow us to do the prior approval and make that effective date after the decision has been rendered is so that you can ensure that you've been approved for those services prior to rendering the service. But I would definitely like to follow up with you to determine some opportunities there. If you want to provide me with your contact information.
Okay, do you want me to put it in the Q&A or do you want me to tell you?
Yeah, you can give it to me now, or is the Q&A in the chat? I can take it from there. It doesn't matter. Whichever one is easier for you. Yeah.
I'll put it in the Q&A and then you can.
Okay. Thank you.
Mm-hmm. Thank you.
Okay, thank you. Mr. Brown, can you also please put your contact information in the chat for Remy so she can ensure she's got all the correct contact information for you? Okay. And next, Dion, your hand is up next. Okay, you can unmute, please. Dion, I still see you muted.
I'm Treva Jones. I have a question. Can you hear me?
Sure. Yes, I hear you now.
Okay, I work at Healthy Life Choices, and I was just curious. I get a lot of referrals from hospitals upon discharge for suicidal ideations, mostly with children. And so when they're discharged, they may have suicidal thoughts. And do we have to get like a prior authorization because they present with chronic suicidality? So when we present the claims, they're rejected because we don't have a prior authorization. My question is, who can I contact directly so that we can not have this constant challenge because they're discharging them with a high suicidal acuity? They basically reject the claims.
So, ma'am, are you in network with Peach State Health Plan, Healthy Life
Yes.
Choices? You are, okay. Maybe we need to connect with you on some of the claims examples that you have.
Yeah, because they may. This is Remy Rodriguez again. It may be due to if the provider you're billing for, it was not loaded. Sometimes claims can be rejected for many reasons. One of them being the member may not be active that moment in time, other that the provider may not be active in Medicaid at that point in time. So as Brittany said, if we could get some claim examples, if you could also put your information on the chat, we will email you, get some examples, and we can tell you what may be causing the rejections.
All right, and it looks like we have another person with their hand up, Robert.
It was me asking
Oh,
on
it was
his,
you.
yes, so
Oh,
the call had dropped when I was trying to get clarification. So we
okay.
definitely need our rep to support us because I'm a trauma provider and they always send me patients from CHOA and Riverwoods, all those different hospitals. But then that's going to be a presenting issue until they get through treatment. And so their claims are rejected. So that would be very helpful if you can help Robert to get the claims. We can get the claims to the right person so we could provide the services.
Yes, ma'am. We will get your provider relations representative to outreach you. If you don't mind going ahead and putting your email and phone number in the chat, we can have that happen in the next day or two. And that way we can get a better understanding of the reasons the rejections are happening and work with you closely to resolve.
What's the number to call? I was trying to hear and then I was trying to give it to Robert so he can hear. What's the follow-up information? Who am I
Yeah.
calling?
If you would like, you can either email me, Remedios Rodriguez Dominguez. My email address is REMEDIOS.RODRIGUEZ@Centene.com. But if Robert or yourself will also please put your information on the chat, we'll have a provider network specialist reach out to you and help you resolve this issue.
Please. Okay, you said to email you directly.
Yes, ma'am.
You have the email address? Yes, he has the email address.
Hey, do we have any other questions?
Great. Well, thank you everyone for joining the Peach State Health Plan session today. Please let us know if you have any other questions. I'm going to give you my email address as well before we end. My name is Brittany Mathis, and my email is the letter B as in Brittany Mathis, Mathis @centene.com. You can also go out to our website. We have our provider network specialist territory list out there as well that has all of the provider network specialists listed for each either key account or county. Thank you so much for joining us and have a great afternoon.